The following portion of Daytime Tri-Cities is sponsored by State of Franklin Healthcare Associates. Recently, State of Franklin Healthcare Associates formed an Employee Stock Ownership Plan, or ESOP, for the healthcare provider network. But what does this change mean for patients? This morning, we want to welcome Chief Executive Officer Robert Slattery and Dr. Frank Johnson to Daytime with answers to that question and many others as well. Good morning, gentlemen.
Good morning.
What was the motivation behind starting the ESOP?
Dr. Johnson?
I think there are several, but I think one of the main ones was to help us to continue to provide excellent medical care to our patients, to remain patient-focused and just continue our excellence of tradition. And we felt that that the ESOP would give us the strength and autonomy to continue this, and it's really to keep the patient in front, and also it's really going to help our team members as well.
Absolutely. And to talk about, there is this decision, how does this align with your vision and your vision plan?
Well, I think it aligns perfectly from the perspective of our mission's always been to really ensure that we provide the highest quality of health care to people in the community, our patients, as well as our team members. So when we think of how that aligns, culturally, it fits in the sense that it puts us in a position to engage each and every team member in providing the highest level of care, even those that may not be providing direct patient care. Mm-hmm. So it's those that greet the patients as they come into the office and those that process the transactions behind the scenes as far as the claims. So from that perspective, mm-hmm. it really does help us to take another step. And as Dr. Johnson said, it allows us to create and continue the legacy of SOFHA, right, which has always been a consistent, high performer, very focused on high quality patient first care.
As far as direct impacts to your patients, will this formation of the ESOP have any direct impacts on your patients?
We think so. It will allow us to continue to provide the excellence in care we've done. It will, with the shared ownership and reinvesting, it will allow us to have the resources to maintain and expand vital health services, and it will motivate our team members to go above and beyond to care for our patients. So I think you'll see it on multiple levels directly improving and helping us to continue the focus on patient care.
Yeah, as we mentioned, right, each and every team member is going to be a partial owner in
right,
their medical practice. So from that perspective, having an ownership mentality, right, we expect that it'll be, just as Dr. Johnson said, another step to be able to take us above and beyond in how we address the patient's needs.
And how common is it an ESOP for medical groups like yourselves? How common is this in medical history?
Wow, it's really not that common. Mm-hmm. It's been something that has just started to catch the attention of organizations like ours, right, but primarily in the specialty practice. As of today, as we look to go into the new year, we'll be the largest multi-specialty practice that has adopted an ESOP, but a lot of reasons go behind that. And I think our ability to maintain culture, the independence, engage the team members in providing outstanding health care to the people we serve in the regions that we currently have clinics, it will really, I think, set a precedence for others to look at this model and look towards us to help them find a way in which they can participate in an ESOP model for their organizations and their team members.
All right, gentlemen, thank you for stopping by, sharing this news with us. Important news for patients, your patients, all across our region. SOFHA.net for more information about everything we discussed here this morning. We'll be back with more Daytime coming up. The preceding portion of Daytime Tri-Cities was sponsored by State of Franklin Healthcare Associates.